Onelife Training team. I'm Rosie.
I'm Steve.
I'm Emilia.
And I'm Charlene.
And what are we talking about? Bumps and bruises?
Yeah, bumps and bruises, head injury, things that I think people get quite tangled over.
So we want to make it as simple as possible with your bumps and bruises. Yeah. And we all agreed that we could go into a right load of depth, couldn't we, about looking at this, looking at that, looking at the other thing. But we want to make it as simple as possible for you so that you understand how to deal with a bump and a bruise and when to be worried about more serious head injury. So, I don't know, who wants to have a chat about that?
I think if I treat bump and bruise on majority of your body, fundamentally bruising is bleeding under the skin. With a bump you might get a little bit of swelling. That can be easily treated with a cold wet paper towel, which is pretty much my saying for that is your first aid advice there. But I mean, equally, like an ice pack wrapped in a towel or something, if it's severely swelling or really painful, that's going to help with the swelling and with pain.
And as you mentioned, if it is like, if it goes off within 24 hours, then you don't need to seek A&E.
Yeah.
But again, it depends on which part of your body.
Yeah.
If it's something to do with your head, then obviously you need to go and seek medical attention.
Which is the thing we worry about a bit more.
Especially in children.
Yeah.
And elderly.
A lot of it depends where the injury is on the body as well. You know, if it's in an area like joints, there might be more damage to the joint, swollen joints. If it's just on the open skin, not too bad. Bruising and swelling is the body's natural reaction to something, so we shouldn't worry about it overly. Sometimes there's a feeling that we should just cure things straight away, but it's just a natural process.
Yeah.
So a lot of people get bruises, get minor swelling, not a big thing. Just watch it and be wary.
Yeah, yeah. And I think I don't know what it's like in your courses, guys, but when I ask about how do we treat a bruise, most people just say you don't, you just ignore it. But there are times when we don't ignore it, you know, and as a first aider it's actually our job to assess and decide whether it needs some further attention or not, and knowing when those times are is really, really crucial.
So significant swelling or significant pain, and that is not getting better.
Yeah.
But the head, I guess there's a few things to look at with head injury, because we could deal with concussion or compression. One being the compression being a very serious condition. Concussion will generally you will recover on your self-recovery, although you still need to get it checked out because you can't see inside the head. So what kind of things are we looking at in terms of with head injury, the key things, I guess if we had to bullet point, that we would be concerned about, where we would need to consider?
Well, anything out of the ordinary with casualty, or anything that seems over the top, it might be a minor bump. How you think, well, that's no big deal. But then the person is feeling sick, feeling nauseous, or they might actually be sick.
Yeah.
They're not getting any better. They might be dizzy, confused.
Yeah, so changing your consciousness.
Yeah.
Different personality,
I
different
think even
presentation.
blurring of eyes, the vision can be affected, intense headache. Some of them do complain of headaches.
Yeah, pupils. So you've got a nice acronym in first aid, PEARL, pupils equal and react to light. So if they're not doing that, if one is not reacting or both not reacting, that could indicate a head injury.
Yeah, and your dilated pupils are a concern as well. We're looking for normal pupils, aren't we? Well, that's what we want to see when we look at someone's eyes, normal pupils.
Or a classic sign is the odd sized pupils. If you get different sized pupils, that indicates pressure inside the head. It's not good. Fairly obvious thing to say too.
You might have changes in how that person is moving their body. So gross motor or fine motor skills may be affected. And the key thing I think here is deterioration. So if that person is deteriorating, that is an urgency. Either way, you're getting checked out, right? You go to A&E or a walk-in clinic, depending on the severity or the level of emergency. I say with children, always go to A&E. They're great paediatrics. But yes, deterioration is that key thing you're looking for.
And I guess we better clarify, because we're talking because we know about it, but what is concussion and what is compression? So concussion is when our brain's been shaken about in our head, and compression is when it's been pushed, you know, and squished down. And as you said earlier on, compression is the one that we're really, really concerned about, because compression is the one that's probably going to kill you over concussion. So
From a first aid point of view, the key is watch the casualty. I think previously people would say, "I'm going to lie down in a dark room" or something like that. If you leave somebody with a head injury, you know, it's one of those injuries needs watching.
Yeah.
You have to
Especially
keep-
I think the elderly population, because they repeatedly fall from time to time and they ignore, and they might be on blood thinning medication, to be honest. So they might have a bleed in the brain, which might not initially be shown, but I think by time, as you said, the deterioration is the key. They need to be get checked.
And I hear all the time people say, oh, I came across this incident where this person had fallen over in the street and they'd broken their arm or they'd hurt their leg, and everyone's concentrating on that physical injury that they can see and actually not realising that they've also hit their head. So I think that's why we need to really be quite cautious with things like falls and trips, about asking questions and getting information and monitoring.
I think that's it. Yeah. Is that